A health center in Roxbury is starting a 3-year campaign to ensure the survival of its programs for treating substance abuse. For the Dimock Center, the main challenge is to provide a building for treatment under medical supervision. The current facility was built in 1880 and it needs a full renovation. To talk about the strategy for meeting the challenge is our guest from the Dimock Center, the President and CEO, Dr. Myechia Minter-Jordan. Thank you very much for being with us, Doctor.
Thank you for having me.
First of all, people hear substance abuse treatment, there's an assumption maybe this is all the same no matter where you go, but at Dimock, maybe that's not exactly the case.
No, it's not. In fact, what we have is a very comprehensive model that addresses substance abuse and recovery from the moment someone walks on the campus. So they will enter in potentially into our inpatient detox and stay there up to 5 days. Then they can transition into one of 4 halfway houses that we have on campus, as well as engage in outpatient addiction recovery programs, day programs, half-day programs that help to address the root cause as to why that individual is suffering from drug abuse or substance abuse.
When you talk about the needs in a building for this, where you're going to have some kind of medical supervision, what do you need in a building aside from structural integrity and the systems working?
So there's a lot. Part of what our model is based on is being incredibly comprehensive. So there's case management services that are infused into the treatment. There's nursing care, there's physician care from our associated health center that's right next door to this building. So the model that we are looking to fund is a model that has the case managers embedded in the unit. It has nurse and physicians that are on the unit as well in a very open manner. And there's also meeting space for the patients and clients to be able to undergo group therapy, to hold classes, to help them in terms of job training, GED preparation. All of those things can happen in this unit, and the way that we have it planned out is to be able to increase access to Boston and beyond, as well as infuse in it and really integrate those various services. Mental health is a very important component that's also integrated into the unit by having clinicians and access to a psychiatrist on the unit as well.
And I know you're not there to pamper people, but at the same time, you do want them to be receptive.
Right. We want them to be receptive and we want them to feel respected. Part of coming in when you're at your lowest is being able to accept the treatment and feel respected as you receive the treatment so that it can be a collaborative process. And so the model that we've outlined really allows for all of that, allows for the client or patient to really become empowered as they begin on this long road to recovery.
What about the rate of success? I mean, with substance abuse treatment, it doesn't always work. We don't really expect it to be 100% each time.
Right, it's tough. There's a large rate of recidivism that all intake facilities, such as our detox facilities, also have to deal with. But by making the model more comprehensive, by addressing the mental health needs and trying to really establish a pathway for these patients and clients to then begin to move into, we're hoping that we can reduce the recidivism rate. When you know that you're leaving a detox, to know that you have the next step laid out for you in terms of being able to go to one of our recovery homes or engaging in our outpatient addiction services, that makes it much more of a stable road for one to travel on.
Well, what about the building as it is right now?
It's a tough building. I mean, our campus is over 151 years old, and it doesn't necessarily, the current design doesn't allow for the integration that I mentioned in our future design. So what we're doing is we have those services there. They're in pockets. Some of them are in silos, and we're hoping that through this renovation, we'll really be able to move forward with this comprehensive integrated model that we have the beginnings of, but really need the facility and the space to complement.
Of course, another way of looking at how important this is I guess, by factoring in the wait list. I mean, there must be a waiting list.
This is a tough issue that we're all dealing with from the federal level down to the state level, where there's a dearth of substance abuse programs. We're one of 3 detoxes in the city, one of 30 across the Commonwealth, and we know that the need is much greater than we're able to meet. So with every bed that we increase in our inpatient detox through this renovation, we can afford over 100 more patients to be able to come into care. Currently, we see about 3,000 patients a year. We're a licensed facility of 30 beds. For each additional bed, we can increase that number by 100 to 200 patients per year.
Well, if you could solve all your problems with public funding, the pitch would be very simple, because the more you spend on detox here, quality detox,
that's right,
the less you might spend on some other things such as incarceration. But
exactly.
I guess you need more than just public money.
Yes, we need public money and awareness, and we also need foundations, private individuals. As you and I mentioned earlier before we started rolling, there's not one family that I have ever seen that isn't touched in some way by substance abuse. And it resonates with many of us as we've seen our family members, friends struggle with substance abuse. So by asking individuals to step up and to help us, help other people on the road to recovery, we're hoping that we can have that much more in terms of funding to help this project move forward.
What about the other components here? Because I guess there's also an early childhood education component as well?
Yes, so Dimock as a whole is much more comprehensive than the detox. So we have primary care services that really run the gamut of adult and pediatric care. And when clients come into any one of our recovery programs, they have access to that care. We also have child and family education. We have adult GED programs. We have Head Start, early Head Start programs that clients can take advantage of as they move into one of our recovery homes or into more stable housing.
So you're not just integrating services with different kinds of health problems, but you're looking at the whole situation an individual or a family might be in.
That's exactly right. My hope for Dimock, as the relatively new president there, is that a family member or a family comes into Dimock for care, and we can really help them to evaluate all of their needs and make sure that all the services that we have are available to that family, and to really track the family and track the outcomes and change the measure of how we look at public health and look at our impact on the community. Because I firmly believe that our impact really will be measured by how well we do in terms of helping patients to care for themselves, empowering them in terms of education, as well as behavioral health and primary care.
Well, we should mention, if people want to find out more information about the program or find out how to help, is there some way they can do that?
Yes, www.dimock.org is our website.
Thank you very much for being with us.
Thank you.
From the Dimock Center, Dr. Myechia and Jordan. We'll have more news in just a moment.